Menopause is a natural occurrence that occurs in the 5th decade of life that takes the woman from her reproductive age into the postmenopausal period. You're probably not going to get very many questions on menopause on the test. But just in case, I want to show you the things that are going to be distractors, things that you don't do when in dealing with someone who has menopause. Of course, over the span of a woman's life, around 11, she'll have the onset of menses, menarche, and around 51, she'll enter menopause. And what menopause is essentially ovarian failure. And because the ovaries fail, she'll have decreased levels of estrogen. What the patient will feel is a number of symptoms that comprises a syndrome, and not every patient feels the same symptoms. The one that most patients feel the most of are the hot flashes, also called hot flushes. She'll be hot when everyone else is cold, or she'll break out into a flushed rash all over her face. The patient will also develop vaginal atrophy. This is the most common cause of postmenopausal bleeding, especially after sex. Estrogen does drive sexual function, and even though postmenopausal women may still enjoy sex, their libido will be significantly decreased. And now the patient doesn't normally complain of this, but her family and spouse do. There'll be significant irritability and mood swings. You can generally get this by talking to the patient's family members. But even though these are the symptoms the patient feels, the actual definition of menopause is the cessation of menstrual periods for 12 consecutive months or 12 consecutive cycles. And if you find a woman who is in the 5th decade of life who begins to experience these symptoms and begins to have spotting or periods that are not quite as heavy or don't occur quite as regularly as they used to, you can simply suspect menopause. That is, it is a clinical diagnosis. If you checked an FSH level or an LH level, you'd see that they were elevated because the anterior pituitary is still trying to drive the ovaries to produce estrogen, which will be low. But menopause does not require getting these blood tests. It's a clinical diagnosis and you can stop there. The only time you may want to investigate is if it is pathological, that is, it occurs in less than 40 years old. There's a bunch of treatments out there to help women overcome the symptoms of menopause. A sort of a holistic approach is the phytoestrogens, that is, soy products. There's not any good evidence that this works, but it might abate some very mild symptoms. Do not prescribe phytoestrogens. There's no harm in doing them, but on the test, this is not going to be your answer. Hormone replacement therapy, 30 to 40 years ago, was to be the end of aging. Since women get older and start to get wrinkles after menopause, it was presumed that the absence of estrogen caused aging. So in an attempt to overcome aging, women were placed on estrogen. It abated all of their symptoms, but also all that estrogen ended up causing breast cancer and endometrial cancer. Don't use hormone replacement therapy, and if you do, only use it for a short course to overcome very severe symptoms of menopause. Right now, the drug that you should pick, venlafaxine, the SSRI. There's really good data that shows that SSRIs abate the symptoms of menopause, in particularly the hot flashes. So if you're going to pick an intervention other than reassurance on the test, make sure it is venlafaxine. And finally, if she does have bleeding after sex, vaginal creams and lubricants will help with the vaginal atrophy. But also remember, estrogen is protective of more than just symptoms. Women are at risk for development of osteoporosis, and so needs a DEXA scan at age 65 or 60 if she's at higher risk. And she may benefit simply from being placed on vitamin D and calcium from the start. If she is deficient, if she does have osteoporosis based on the DEXA scan, you can include alendronate. And estrogen is also cardioprotective. So if you're worried about cardiovascular disease, in particular coronary artery disease, you'll also want to get a lipid panel and treat with statins. And so menopause is a normal thing that happens to all women. It is representative of ovarian failure. If you see a woman who's in her 50s who begins to have irritability, mood swings, infrequent or not so heavy periods, the change is coming. No diagnostic approach need to be taken. What you need to do instead is just help her get through her symptoms, and then as she ages, continue to monitor and screen her for disease that may come after menopause. That's menopause. We make these videos for free, and we need your help. Please donate, because without your donations, we can't make any more videos. Please donate.